Good morning to you all and welcome to our NHS West Yorkshire Integrated Care Board Annual General Meeting. Thank you so much for those of you who have joined us in Huddersfield today. Around the table we have members of our board representing the breadth and depth of our health and care partnership, and thank you to people who have come to observe the AGM today. We are reflecting on our financial year during April 2023 to March 2024, our second year in operation as a statutory organisation, as the Commissioner of NHS Services in West Yorkshire and also the convener of our Health and Care Partnership. It was a challenging year, which I'm sure my colleagues are going to talk through in a moment, a variety of pressures on services, and you can have a look at our annual report, which gives a breakdown of the performance around different areas of service provision. We also had industrial action and also within the Integrated Care Board revising our operating model in response to a national request. What I'm really proud to see over those 12 months is that we continue to work as a true partnership in overcoming those issues and supporting local communities to be healthy and to support their well-being. I want to thank everybody within the Integrated Care Board, but particularly people around the table here for their contributions, and special mention particularly to our executive team and to Rob, our Chief Exec, for leading us through those 12 months or so. We have a presentation today and a series of speakers to reflect on those 12 months, and I'm going to hand over to Rob, our Chief Exec.
Thanks very much, Chair. Hello, my name's Rob Webster. I'm the Chief Executive. It's nice to see people here today, and it's good to see partners represented around the table. So I'm just going to briefly introduce the annual report and accounts, and then Bev and James are going to talk about quality, and Jonathan's going to talk about resources. I just remind people that we are an integrated care board, a statutory organisation that supports an integrated care system. And the integrated care system is made up of the NHS, the third sector, councils and our communities. And our system really aims to improve outcomes for local people. And we need the partnerships that we have because people's lives are impacted by housing, education, the environment, the context that they live in, as well as access to care and the quality of the care that they receive. And our integrated care system is not here.
You carry on. I think so.
Okay.
We've got an issue with the presentation slides, but Rob, please continue.
Okay. I don't have any slides, that's fine. So our integrated care system is focused on reducing inequalities, managing unwarranted variations in care, making sure that we deliver good value for money for the taxpayer, and delivering the biggest return on investment that we can in terms of social return and economic return from the money that we spend. So as an integrated care board then sitting within that system, we're here really to deliver with partners the strategy for West Yorkshire that's going to improve outcomes and do those other elements of our main mission. And in doing that, what we've really crystallised in the last year is that our role, our unique role in the Integrated Care Board, is to make sure that we coordinate the system when required. So Cathy talked about strikes as a really good example of that. So how do we coordinate our efforts to make sure that the impact of industrial action is not felt in the safety of care delivered to patients? Obviously there'll be disruptions to individuals' experience, but safety is not disrupted. So our first role really is system coordination, whether that's around emergencies or in planning for the future. The second role is thinking about population health. And you can see within the report some brilliant examples where we've thought about and acted upon issues affecting different populations. So we know that people with a learning disability die sooner than others in society by at least 20 years. And you can see in the report the work that we've been doing to improve that position, prioritising people to be seen for surgery, prioritising people to have their annual health check, making sure those annual health checks are good, prioritising reasonable adjustments for vaccinations and so on. So that second role around population health is critical and will continue to be critical going forward. Our third role is to develop the partnerships. So we're here really to make sure that whether it's in the 5 places of Bradford District and Craven, Calderdale, Kirklees, Leeds and Wakefield, or whether it's across West Yorkshire, we have partners who can deliver at the right scale for people, whether that's in their own homes, in a small practice, in a neighbourhood, in a place across West Yorkshire or beyond. Our fourth role is to help transform services. We know from Health Watch colleagues, from people around the table, from what staff tell us, that we don't always meet people's needs in the way that they need to be met. And that means that we have to change the way we deliver care to improve the care. It needs to be more joined up, more integrated, more focused on what happens to people in their lives every day. And then the final one of our 5 roles is to make sure that we focus on our workforce. You can't integrate care without integrating the workforce. And we know that really good teams and teams of teams working around people deliver better outcomes. So this is what our organisation does with £5.5 billion worth of investment from the taxpayer every year. And you can see within the annual report that the things that we've been asked to do, the things that we've been tasked to do, the risks that we've been trying to manage have, in the main, been achieved or managed. And that's not to say that everything's great or that everything's back to where it needs to be, but the things we've been asked to do, the things we've been tasked to do, have been delivered in the main. And you can see in the board assurance framework and the risk register the issues that we've faced around cost of living crisis, impacting on people's health and well-being, the impact of industrial action, burnout of staff, etc., have also been affected. What that means, I think, is that if you look from a regulatory perspective, what does NHS England expect of us? What do we expect of ourselves? The targets that we've set have largely been achieved, but it's pretty clear that we're not achieving the constitutional standards. That's something that isn't being achieved across the country. We're largely not achieving the constitutional standards around things like 18 weeks, waiting times, 4 hours in A&E, etc. We're on a journey with a set of standards that were being set and trajectories to get back to that point, but we're not there yet. So there's a lot more to do. So that combination of recovery and transformation will go into the future, I think. What we've also got, though, is to recognise that we're not only focused on national targets and standards, we're focused on local people and communities. And it's really brilliant to see in the report how we've done that, how we've become the first system of sanctuary in the country, how we've ensured that the lives of people with a learning disability are prioritised in our acute organisations, the work we've done on inclusion health with our Core 20+5 money for homelessness, for people facing dental problems when they're homeless, and so on. And the recovery of dental services now where we've picked those up has been, I think, significant. I do think that as we go into this year with a new government which wants to see improved outcomes, with a report by Lord Darcy that says things are difficult in the NHS, the vital signs are strong, we need to keep moving forward. That the fundamental shifts that the government wants to see, they describe it as from secondary to primary care, from treatment to prevention, from analogue to digital, are things that are all within our strategy, all within our plan, and all within our gift, so we should look forward to that. And finally, before I bring the others in, I think I would just like to also add to Cathy's thanks. We have proven again that collaboration in the service of the public in ways which improves outcomes is the right and only way forward. It's more difficult than competition, in my view. It's more difficult to collaborate with each other than compete sometimes. but it's the right thing to do and delivers the right outcome. So I'd just like to thank all of the partners and all of the staff who've been involved in all of the work that we've done over the last year.
Rob, thank you very much. Appreciate that. We are just, there we are. Our presentation is now working again here in the room and on the live stream, which is great. So thank you, Rob, for your opening remarks. Before I hand over to other colleagues, I just wanted to do the general meeting business, which I know, Laura, could we just take a note of the apologies for the meeting, please?
Thank you. Yes, we have apologies from Robin Tuddenham, Brendan Brown, Sarah Munro and Keisha Licker is deputising, Jane Madeley, Anthony Keeley and Lou Auger is deputising, Fatima Khan Shah, Showkat Ali Khan and Rachel Loftus is going to be joining us on behalf of the partner member for local authorities.
Thank you very much. And for anyone interested who's in the room today or watching on live stream, we have a declarations of interest portal which you can look up, which is kept live. That's also an opportunity for me to remind people around the table to keep that up to date as well, which is part of our declarations of interest process. I will now move on. I just want to check the presentation is now working. Yes, it is. Fantastic. So I want to hand over to Beverly Geary and James Thomas for the next section of our presentation for the annual general meeting. Beverly and James.
Thanks, Chair. Good morning. My name is Beverly Geary. I'm Director of Nursing for West Yorkshire ICB, and I want to take this opportunity to share with you some of the really good work that we've done over the past 12 months. We, as Rob's just said, working collectively and in a consolidated function has meant that we can have, I think, greater impact, particularly in the quality and safety area. So we have consolidated our functions, and what that means is we brought together all of our teams across West Yorkshire from the 5 places in order to address some of the risks that we have that feature on our risk register, but also to look at some of our 10 big ambitions. And some of the things that I will share with you briefly now will probably resonate with some of you. So the consolidated function, as I've said, has come together, and what we've done is we've appointed a patient safety specialist. What that person does is will improve safety culture across West Yorkshire by learning from incidents, and we plan to engage more readily with our public and to employ some patient safety partners across West Yorkshire. So it's a really new role and we're really excited about that. We are leading for North Eastern Yorkshire as responsible officers for the Safeguarding Work Review. This will ensure sustainability for safeguarding teams, not just across West Yorkshire, but beyond, by looking at new roles, but also about the increasing risks across that statutory function. We've got a real focus on quality oversight now, as I've said, across West Yorkshire, because the 5 teams are working together, and we're doing some really focused work on care homes, in private mental health providers and in other providers across West Yorkshire. I think it's fair to say that the regulatory input that other agencies like the CQC, etc., have, working collectively with them to ensure that we've got real quality services for our patients and public across West Yorkshire. In order to focus on some of our maternity services, we've appointed a Director of Midwifery to West Yorkshire Local Maternity and Neonatal System. She started fairly recently, and already we're looking at how we improve access for our some of our deprived areas. And we're already developing plans to increase support for women from some of those most deprived areas across West Yorkshire. And we've already introduced some health equity midwives, which we are already having some really positive impact. In addition, all of our provider organisations have got above the 85% national target for the Saving Babies' Lives initiative, and some of our trusts have got 95%, which again is really to be celebrated. And in addition, I think last year we talked about workforce, and it did feature on our risk register that we've got a significant gap with some of our midwives. The local neonatal and midwifery system have come together and recruited for West Yorkshire, and very soon in the coming weeks we've got another 142 new midwives across our trust, which means that that workforce gap will be significantly reduced, and I think that's featured on our risk register by a reducing risk. In addition, in this space, we've increased the capacity of our Midwifery Voices partnership. So what that is they are the service users for our midwifery services, and we work with them collectively to improve our both access, inequalities, and they're from the local population that they serve. So we're also recruiting a strategic lead that will work independently with those Maternity Voices partnerships in order to improve services. I think Rob's already mentioned our focus on annual health checks, and we've had some days for providers and users of services, and we've seen earlier intervention with that, and also we've had some West Yorkshire-wide leader events, so that's learning from deaths for people with learning disabilities and autistic people, and we're focusing on cancer screening and other things, so that's some really positive things that I'd like to share, and then I'm going to hand you over to Dr. James Thomas. Thank you.
Thank you. So my name's James Thomas. I'm the Medical Director for the West Yorkshire Integrated Care Board, and welcome to everyone. And thank you, Beverly, for that. So I'm going to, I suppose, pick up on a few areas, but there's a huge amount in our annual report which demonstrates some of the kind of areas that both quality, safety, and innovation have happened over the last year. To recognising the kind of, as Rob has mentioned, some of the risks that we have as a system there, our ambitions as a system, also some of the standards we're aiming to meet, and then as has been mentioned, some of the day-to-day kind of challenges we've had, including things like industrial action there. In order to achieve some of that and to ensure that we mitigate against some of those risks and actually we deliver that high quality services that we all want for our system and for our population, innovation is key to that there. So I'm just going to highlight a few examples of what we've been doing across West Yorkshire, showing innovation, which kind of meet some of our ambitions, meet some of those challenges that have been highlighted there. Our Mental Health and Learning Disabilities and Autism Collaborative have been developing kind of workforce initiatives, engaging with schools, engaging with colleges to ensure that we kind of look at careers within mental health and learning disabilities and autism there, and rolling out some cultural competencies there, work on inclusive recruitment to ensure that our providers are include and ensuring diversity within their workforce, which again is one of our ambitions as a system there. Despite the challenges we see across our system, we've also seen that through our long-term conditions, and particularly with our blood pressure checks across West Yorkshire, and ensuring our people are being picked up in terms of having high blood pressure, hypertension, and that those levels have returned more quickly to the pre-COVID position than before, and across England we're in the top 8 nationally with that, which is fantastic to hear, given the demand and the challenges we know that sit across primary care there. Also, in terms of cancer, one of our big ambitions there is about targeting and preventing cancer, but also about picking people up early on. We know picking people up early on are better outcomes for people there, but specifically in those populations are most deprived. And I'm kind of building on targeted lung health checks that have been rolled out across West Yorkshire. For the first time ever, new data shows that more than a third of people diagnosed with lung cancer from the most deprived fifth of England were diagnosed at stage 1 and 2 last year, which is up from our previous years there. So again, really key to see that we're seeing innovation is enabling improvement and is supporting some of our ambitions there as well. Innovation is key to this all. And again, looking at collaboration, working with our West Yorkshire Combined Authority and working with a health innovation network, we've actually been able to secure £7.5 million pounds for the region via Innovate UK Launchpad grant, which will help in enhance and embed health tech innovation for the needs of West Yorkshire and its population there. So again, really key about working across health and our local authority to kind of bring the best for West Yorkshire there. I'm aware of time, and there's so much more we could be talking about. There's a lot within both this slide, but also in terms of our report. Other things I think we should mention, especially given in a week's time, our vaccination, COVID and flu vaccinations start again for the winter period. But now, in terms of COVID vaccinations, we've now delivered just over 6.6 million vaccinations across West Yorkshire since the programme originally started. That's a huge amount there. Lots of campaigns over those years, over this last year, working with our primary care networks, working within our communities, and working with our trusts. And so that during the last campaign in spring of this year, 96% of adults eligible for a spring booster in this campaign had at least one dose since the programme began. So as we embark on the next campaign, it's really good to know that about the engagement, but also it's important that we continue that engagement with our communities, working in our communities there as well. So I'm probably going to stop there because I'm aware of time and pass on to back to Chair, if that's okay.
Thank you, James. Thank you, Beverly. Much appreciated. I'm now going to hand over to Jonathan Webb, particularly to talk us through the part of our annual accounts. Jonathan.
Thank you, Chair. So I'm Jonathan Webb. I'm Director of Finance and Deputy Chief Executive at the ICB. The real detail in terms of how we spent our money and where we spent our money is contained in the annual report and accounts. But what I will do today is just to provide a brief overview of some of the key aspects of performance and assurance. So it was a challenging year for the NHS in 23-24. Despite that, as an ICS, and I'll use a slightly different definition from a financial management point of view than the one that Rob used earlier. So this is about the 10 NHS provider trusts in West Yorkshire and the ICB as a statutory body. So as a system collectively, we set a break-even plan for 23-24. That was made up of a surplus planned in the ICB of 25 million, offset by an aggregated deficit across the 10 NHS providers of 25 million, so overall a balanced plan. In-year delivery was slightly different from that, so as an ICB, whilst we had a plan of 25 million, we actually delivered a plan of 4.3, so a lower surplus than plan. And NHS providers had a deficit of 4.1 million as opposed to a deficit of 25 million, so a better position than plan. But taken together, the system delivered its overall position and actually finished the year with a small surplus of 0.2 million pounds on an allocation of 5.6 billion. So 0.2 million is not a lot of money, and so is 5.6 million, and there's just something about materiality in that regard. I should say that the key reason for the differences in outturn compared to plan relates to a non-recurrent transfer of cash at year-end from the ICB to providers. And that was really to support and alleviate borrowing requirements that otherwise would have had to happen within our provider sector. So that's where we finished the year. So a really positive year in terms of delivering our financial targets. And this next slide goes on to talk about that in a little bit more detail. So we delivered our key statutory financial duties in terms of revenue, capital, and also our running cost allowance. We also paid our suppliers on time, which is really important, both for partners, but also in terms of being a key partner and player in terms of the local economies that we play a significant part in. So we delivered what's called our public sector payment policy across the 4 metrics and delivered 96% compared to a target of 95. Clearly we will always strive for 100, but that's a pretty good performance in 23-24. What the accounts also contain, and what's really important to note at this meeting, is the assurances that we seek and obtain from external bodies. So as an ICB, we received what's called an unqualified, so with no caveats, an unqualified external audit opinion for our accounts. We also received a positive value for money opinion, which relates to how we deploy our resources as an ICB and as a system. And finally, the Head of Internal Audit opinion for 23-24 was that they provided us with significant assurance that we have the systems in place and they are operational in the way that our internal auditors would expect. So a clean bill of health. Next slide, please. This final slide, apologies for people in the room because it is a little bit small. What it attempts to show is where, as an ICB and as a system, our money goes against our key programme areas. As I say, the report and accounts provides more detail in terms of the benefits that delivers and how it supports the 4 objectives of an ICB. What it does show, though, is that roughly half of our £5.6 billion goes to what we call secondary care or acute hospital care, the bulk of which is within the NHS. The next largest is primary care and prescribing, so the contracts and the expenditure that we have to support our GPs and their teams and dentists and their teams, as well as the cost of drugs prescribed to patients in the community. And the residual then is on mental health and learning disability and autism services, community services, continuing healthcare, and arrangements that we have in place with local authorities to support discharge arrangements and other areas. And all of that money is spent to further the 10 big ambitions and the 4 strategic objectives of the ICB and of the system. That's probably all I wanted to cover today. Thank you, Chair.
Thank you, Jonathan, and we very much note the huge partnership and collaborative effort in delivering a balanced system budget across West Yorkshire and 10 trusts with the Integrated Care Board. So thank you to you for your leadership and everyone involved, including our really proactive Directors of Finance community and our colleagues working across places. I'm going to hand over to Rob to sum up and also to look ahead into what is now the 24-25 financial year we're in.
Thanks, Chair. So I think if you summarise what we just heard, I think what we'd say is that there's been progress against the plans that we were set in 23-24 on performance and quality, with some issues still to deal with. We were successful in delivering financial balance in a year where many across the country didn't, and that's testimony to the partnership working across all of the parts of the NHS. And the organisation remained well run. So clean accounts, good value for money audit, delivering, our financial payments to our partners very quickly to make sure that they remain solvent, etc. And that was in the context of a operating model review, 30% reduction in management costs, which caused significant distraction, as well as the additional external impact of things like industrial action, etc. So it feels to me that the staff in the organisation deserve a huge amount of credit, as do our partners. It's worth reflecting that the staff survey remained comparatively good when we look at ourselves and other ICBs, but did take a significant reduction in all areas when it comes to the main themes in the people promise. So the impact of change was felt by staff. So when we look at the year ahead, I think we've got to take that into account. And we've been working with Kate Sims, the Director of People, and the executive and all of the teams on our people strategy for the staff who work here, so that we can make sure that they feel supported, that the other external impacts that have affected them following things like the disturbances, the racism and Islamophobia in society is addressed, and that we build from positive staff and teams that work in West Yorkshire and in all our places. And that model that we have of subsidiarity with places and people connected to their communities remains something that we are deeply committed to. I've hinted a bit about the year ahead in terms of where the new government is with its 3 shifts, and we are in a good place for that. It's worth reflecting that prior to the election, we'd already signed off our joint forward plan for this year and next year, that we were in the process of revalidating our medium-term financial plans to make sure that we are getting back to balance, and we are addressing the issues that we've got today this year on resources. Because if you look at the plans that we've signed up to, for the first time ever, we've signed up to a deficit plan of £50 million, which is itself going to be extremely challenging. The growth in resources for this year across the health system is lower than has been the case for several years, and the position in local government partners is challenged. So collectively we're working to make sure we keep that focus on our 10 big ambitions, you know, everything from tackling inequalities for people with learning disability and mental illness, through to early detection of cancer as reflected by Dr. Thomas, and into the space of making sure that there's an economic benefit to everything that we do and a social return. This is all set out in our joint forward plan, it's set out in our strategy. We don't have time to go into it here, but we keep going, I think, is the key thing. The year ahead is about continuing to recover the position against constitutional standards and to make the improvements that we need to make against the 10 big ambitions in line with our strategy and our joint forward plan. Thank you.
Thank you very much, Rob. And as you fully appreciate, as we move into our board meeting in public later, we will be talking about our delivery and particularly looking at our board assurance framework in relation to the risks for delivery.